Hi, welcome back. So today I'm doing part two on the video from yesterday about Causalgia and allodynia. I I think just along with everybody else, am tired of doctors or anybody just saying it's in your head. Okay, first of all, there is no question in my mind. I want any scientist or researcher, somebody, to go on the video that I did about it actually being nerve related, and it's quite secluded to its area. It can be very contained, and I feel like not knowing exactly what's going on, I think can really agitate the issue and make it even worse. It's important to know exactly what's happening. Causalgia, how is it in your head that the reason that the area is so sensitive to just air? Let me explain that to you. I mean, to me, it's just common sense. Since they went to school, you should know this. Your nerves radiate when when you're shivering. So when you're trying to get warm, when somebody with CRPS and nerve damage goes out into air and it hits it, it's radiating it, and it causes such severe pain because it can't regulate the temperature. You all got that point. Yes, I understand that, but it's restricted to certain areas unless it's at least the ones that are from injury. So from my point of view, because I have it and I've had CRPS for years and years and years, and everything that I see, it's all in your head and it goes throughout your body. Well, how can I have had this since I was 12 years old and I am 47 years old now? Explain that to me. And I can walk, I could do everything. Like, I understand the importance of, since 2000, I think it was 17 or whatever, when I had that surgery, when every single symptom on that Budapest scale was just like, 15 pain constantly. Like, it was unbearable. It was very, very challenging. And anybody who, when you're first diagnosed and have all those symptoms, I think your first instinct is it's overwhelming. You're like, I am so overwhelmed. Where do I go from here? When you don't have anybody telling you where to go from there, where do you go from there, right? It's very important that we help each other here, because I have worked to contain this in the one area for so many years, and I will continue to do that. And I will continue to do the breathing, every single thing that I do. And the doctors are helpful. The ones, and I've expressed that so many times. Sometimes we just have the very best doctors, and they do everything they can to help. When they're not educated and they don't know about it, that's where the problems start to lie, and where it starts to get to be more of a problem. I mean, I'm not saying it's an epidemic. People with CRPS, it's just, there's a lot more awareness of it, and it needs to be, I think, handled in a way that there are protocols. So I guess my part two in my explaining that Causalgia and allodynia, like just that touch, that hypersensitivity, there are ways around it. It's that compression. As hard as it is to get compression, like, this is my arm. This is where it started. I've had many surgeries since then. I had a major crush wound. But this arm, obviously very different from this arm. See, two totally different arms. They function different. Elevation is very important for people with CRPS. Having it in your legs, obviously it's going to be a lot more difficult. I would imagine, I don't know. This is something I want to collaborate with my aunt on, because she does have RSD in her leg, and she's had it for years. I'm going to ask her, and I want to find out more about that. But having it in my arm, this is just it's a hoop. It's a yoga hoop, or excuse me, a Pilates hoop. And I have been using this for the longest time since that surgery to alleviate some of that excruciating pain. I mean, because it's overwhelming to try to figure out how to do your day-to-day tasks that you used to do every single day. because you have to relearn how to do things in a way that you're not functioning with certain things anymore. I, I'll talk about this more in another topic. I just really wanted to um, talk about how much that and compression when you go out in the cold, and I will double layer compression sometimes on my arm if it is really cold. Yes, that vibration therapy does help with the sensitivity to like the vibrations and things like that. But sometimes when it's really cold out, in order to get by doing the things that you need to do, if you have to get outside, um, compression, wrap it tight, that air is not hitting it. It's not going to have to jitter and frizzle and just cause more swelling and inflammation just trying to warm up. So I really hope that this is helpful for somebody. I just realized at the end of this video that I was not looking at the camera. So hopefully you're just listening to the words, and have a good day. Remember, you're stronger than you think that you are, and it is up to you to maintain that strong, okay? Everywhere else you are strong. It's okay to have one weakness, all right? Keep up the good work.